This is the Atopic Dermatitis 5-minute Pearl on the treatment of itch and superinfection. Itching has a profound effect on the quality of life of patients with atopic derm, and it really is best treated by reducing the severity of their disease, generally through the application of topical anti-inflammatory medications or sometimes systemic medicines with dermatology. Antihistamines do not directly treat pruritus, so sometimes we will employ the use of the sedating antihistamines like hydroxyzine or Benadryl if the patient is having a lot of trouble getting to sleep at night or if they're scratching throughout the night, but these are mostly just used for their sedating effects. And then the non-sedating antihistamines like Zyrtec, Claritin, Allegra, these are just generally not helpful. There are some patients who feel like their eczema flares more often during peak allergy season and they have, significant environmental allergies, that we will recommend that they do a trial of these medicines, and sometimes they do help, but for the majority of patients, the non-sedating antihistamines are not super helpful. Table 3C there on the bottom is just the dosing that we use when prescribing hydroxyzine in the pediatric dermatology clinic. So moving on to superinfection, and we will cover bacterial superinfection first. So the first step is deciding whether or not they need a topical antibiotic or if they need an oral antibiotic. And table 4 here is taken from the guideline. It lists some criteria that can help you decide. So in general, we think about giving patients an oral antibiotic if they have an infection that's not responding to a topical antibiotic, of course, if they have signs and symptoms of systemic infection, if they have a superinfection that's involving a large body surface area that's just not realistic for them to apply the topical antibiotic to, or if they are immunosuppressed. So moving on to bacterial superinfection, the eczema plaques actually have decreased levels of certain antimicrobial peptides, and so that, in combination with the fact that the skin barrier in atopic dermatitis is leaky, which allows for easier pathogen entry, leads to more infections within eczema plaques as opposed to normal skin. And the most common bacteria to cause infections within eczema are staph and strep. And so in clinic, we typically start with cephalexin, or if the patient is admitted, we recommend cefazolin. If there's concern for MRSA, based on the antibiogram at our institution, we recommend clindamycin first line, and then doxycycline if the patient is old enough, of course, or Bactrim second line. If it's just a localized area of infection, we typically do mupirocin, as this has good broad spectrum coverage. And in general, you think about at least a 5-day course, although I will say that most providers do 7 to 10 days, and this is probably a little bit safer. Lastly, eczema herpeticum, or HSV superinfection. So this is a bit easier in that there really are just 2 medicines that we normally prescribe for this, acyclovir and valacyclovir. There is a topical version of acyclovir that you can prescribe. However, we don't recommend this, as eczema herpeticum can be quite severe and worsen rapidly. So we do recommend you treat with an oral antiviral. And in addition, the topical acyclovir can be quite expensive for the patient as well. So either acyclovir or valacyclovir is fine. Valtrex obviously has the more convenient dosing schedule of twice daily. And then a 5 to 7 day course is sufficient unless it's a particularly severe case, and then you'd want to think about 7 to 14 days. Thank you for listening to this Pearl on the treatment of itch and superinfection. As always, you can find more information in the evidence-based care guideline from Dell Children's Medical Center. And if you have any questions, feel free to email me.